Today, we shine light on the dire state of primary healthcare centers in Benue State, revealing the harsh realities faced by rural communities struggling with inadequate healthcare services. For many in rural Benue State, accessing healthcare is a life-threatening journey, especially in Onwaboju or Tahe Ward, Otukpo LGA. Juliana Innocent, a local resident, shares her traumatic ordeal.
It's because we no get health center here, not too like hospital for our village here. From here to where we go take antenatal, it will take us like 1.5 hours before we go there. The pregnant dey like 4 months. I can't dey go for the antenatal for one time, and they no at ten d to me. The next month I go. So on my way coming back, I get accident with the pregnant and my leg break, so I no come fit do any business. So I still go back again. Till my 9 months, I come get deliver the baby. The baby come dey shake, all the body come dey shake, dey shiver well well. We still go back to the hospital. The doctor come tell me say na low sugar. Why I no go take my antenatal? I tell am say the hospital too dey far from us. We no get hospital for our place. That's why dem treat the baby like 2 weeks. We come back, the thing still dey. Me and the baby dey struggle. We take medical, we take anyone. The 8 months na the baby come die. So if government go fit help us, pity us, bring back hospital to our place where we go at. Even our children start to sick now, so dem dey die.
Sunday Anyebe, a youth leader in Onwaboju, speaks about the community's plea for help.
At times, our pregnant women depend on the traditional attendant, baby attendant, and which is not too good because it has been causing a lot of problems for us. And our women have been losing their lives due to some complications that the traditional people cannot attend to. So we are calling on government to please come to our aid, to come and give us a very good facilities as they have been promising us. They have been promising us year in, year out, but they have not seen any good results. So
Juliana and Sunday's story resonates throughout Onwaboju and similar communities where healthcare facilities are either non-existent or dilapidated, forcing families to rely on traditional remedies or endure significant challenges to access even the most basic medical care. In the Sendia PHC, stories of loss reveal the life-changing effect of inadequate healthcare. Here, the insufficiency of healthcare services has tragically resulted in the loss of lives, laying bare the devastating impact on families and the community as a whole. Zugwem Udoji, a 27-year-old housewife, lost her twins during childbirth. The facility crushed my opportunity of being a mother of twins. I woke up that morning in February 2023 to an intense pain around my lower abdomen. When my husband took me to the clinic, there was no medicine to relieve me from the pain. Isaac Toyina mourns the loss of his wife, Ngodo, who died 10 days after she delivered a baby at home with the help of a traditional birth attendant. We went to bed that night and she was fine. Around 4 a.m. in the morning, she stepped out to urinate and stayed beyond usual. I came out and found her lying unconscious. I couldn't think of that clinic because even if we had gone there, we wouldn't have found medicine. PHC Awulema in Ohimini LGA lacks essential equipment and is devoid of healthcare workers, rendering it unable to meet the critical medical needs of the community. Mercy Inaligu recounts her devastating losses, mourning the tragic deaths of 3 of her children due to the lack of healthcare equipment and workers who could have identified and treated jaundice in her newborns. At PHC Sepum in Vandekia LGA, a dilapidated structure lacking basic sanitation facilities stand as a clear reflection of neglect. patients and staff alike are forced to depend on nearby homes for essential amenities. The chairman of the Village Development Committee of PHC Sekum, Mark Igba, lamented the situation. People rarely come to this clinic because there's a lack of resources. The healthcare providers do not have accommodation, water, sanitation, and hygiene. They seek permission from the surrounding houses to use their latrines. According to the National Primary Healthcare Development Agency, a standard PHC in Nigeria should meet specific criteria for space, utilities, and equipment. Sadly, none of the PHCs visited meet these essential standards, perpetuating a cycle of suffering and loss. Despite government claims of investment in healthcare, investigations reveal widespread deficiencies across Benue's PHCs. These stories from Benue State expose modern infrastructure decay. They reveal a failure to uphold the basic right to health for all Nigerians.